As we take care of coronavirus, we could be missing other things. From the early stages of the pandemic, doctors have anecdotally asked, where have all the heart attacks gone? You'd expect more cases because of high stress times and the fact the virus and heart trouble can go hand in hand. But people have stayed home for myriad reasons, even if it meant ignoring chest pain. And that means some have died at home. I FaceTimed a patient who chose to get help.
Ron Messer is 48. This is a picture of him with his wife. Weeks ago, he was doing yard work and had some chest pain that went away, but came back.
My wife had asked me, she's like, how are you feeling today? And it's kind of a crazy coincidence because just 2 or 3 minutes before that, I started feeling that tightness in my chest again.
He also had pain from his shoulders to both arms and tightness in his throat. His wife looked up heart attack symptoms. They matched.
And then the last thing that she said to me is, if you're unsure if you're having a heart attack, listen to your body. And so I then said to her, well, I'm listening to my body, and I feel like we should call someone.
In an emergency situation similar to what you see here, paramedics came and took him to a cath lab like this at a Batesville, Indiana hospital.
Imagine with the camera first is what I hear. Looked around, found the clot, found the issue.
I wanted to give you a bigger picture look at what Ron was up against. This is the blockage that was causing his pain.
It was in what experts call the widowmaker artery. If he hadn't gone in, he might have died. Dr. Timothy Henry from the Christ Hospital says it is something that has happened in the COVID-19 pandemic.
That's not what we want.
You've seen an increase in at-home cardiac arrest. Okay.
Yeah, and that's been clearly documented across all of the United States and Europe, actually.
Also documented, he says, a decrease in cases handled at hospitals. Researchers looked at 9 regional systems, including the Christ Hospital.
So we would have expected to see about a 20% increase. Instead, we saw a 40% decrease.
Call it a pandemic side effect. Dr. Henry says they've heard people have been afraid of hospitals in viral times. And
the symptoms of COVID and the symptoms of a heart attack are similar. So people can have chest pain, they can have shortness of breath.
But let the doctors diagnose it.
It's safe to come to the hospital. So you come in, we fix it, you go home.
That's what happened with Ron, who's looking forward to many more years with family.
Don't worry about the corona. Make sure that you're taking care of what you need to take care of.
And we should point out, he says he felt totally comfortable with the setup at the hospital he went to when it comes to separating COVID patients and other patients. He went directly to the cath lab where they took care of the blockage and put in a stent. He was there, he says, for maybe 36 hours. His advice, you heard it, listen to your body and act on what it's telling you. Seconds count.